everyone, and welcome to another episode of Up to the Minute, a live COVID-19 report. And this is, of course, brought to you by the Ministry of Health and Wellness, Belize. So the purpose of this report is to provide the public with updated information about the country's COVID-19 situation. So that is basically what this episode will be about. Remember that the episodes do air Tuesdays and Thursdays from 5 p.m. to 6 p.m. We do encourage you to drop your questions in the comment section so that we can ask our panel to answer your questions. So we'd like to go ahead and introduce our panel to you, the audience. So starting off, we have Ms. Lizette Bell, who is the Deputy Director of Health Services, Nursing. Then we have Dr. Francis Mori, the Deputy Director of Health Services, and Dr. Damaris Cruz, who is a medical doctor in the Maternal and Healthcare Unit. So of course, this episode will be divided into 4 different parts. The first part will be allowing you to know more about the data for today. The second part will be allowing you to know more about the hospitalizations. That includes the ICU admissions, hospitalized cases, and of course the mortality rate. The third part will be about vaccines. So that allows you to know how we are doing as a country with vaccinations. And the last part, which is quite arguably the most important part, would be, of course, to let you ask the questions to our panel, and they would be able to answer you live and direct. So remember, we encourage you to ask your questions. So with that said, of course, we would like to start off with the data. I would like to invite Ms. Lizette Bell to go ahead and run us through today's data.
Thank you, Ms. Casarina, and good evening. And I would like to present today's daily COVID report. And for today, we have a total of 2,042 tests that was conducted. Of those, we had 320 positive cases. So we have a positivity rate of 16.2 for today. Of those 332, 152 are females and 169 are males. We have 272 recoveries and 481 persons are under investigation. We have a total active case at this time of 2,710 active cases. Of those active cases, 52% are females and 48% are males. When we go and look into the data as it relates to the positive cases for today, most of the cases are from the Belize district, which is the current epicenter. We have Belize City with 62 positive cases for today, the Cayo district with 69, Stan Creek district with 77, Toledo with 22 cases, Corozal with 22 cases, and Orange Walk with 24 cases. Thank you.
Thank you so much for that, Nurse Bell. Very informative and definitely got us up to the minute with the COVID-19 reports for today. So the second, of course, we're moving into the second part of the episode, and that will be Dr. Francis Mori, who will be explaining to us more about hospitalization and mortality information and that data in context of vaccination. So Dr. Mori?
Thank you. My pleasant good evening. In regards to the number of hospitalizations that are currently within our facilities, and this includes the Karhushna Memorial Hospital, it includes the private sector, it includes all our public health facilities that extend from Corozal through San Ignacio and down far as PG, and including the Western Regional Hospital. As a result of the cumulative number of cases being hospitalized, we have that currently today we have 55 at hospitalizations, of which 18 are ICU admissions in the areas. In regards to the number of deaths that we have in the country, today we've had 7 new deaths for a cumulative number of 1.93 fatality rate. We have a total number of 449 deaths as of the beginning of the pandemic, which now I believe goes beyond the 18 months period, with a fatality rate of 1.93. The number of hospitalizations, as we had said before, in regards to the cumulative deaths up to from September 1st to October 12th is 88, of which the greater number of deaths is actually seen in the age group of 60 and above, followed closely by those between 40 to 59. Into regards to the different distribution as of April 1st to October 11th, we have for the past months a cumulative number of 122 deaths, distributed with the greater number being in the Belize district, followed by Orange Walk and the Cayo districts. As to note, these are the areas that have the highest number of population. Also, that may be considered is for the Belize district, the context of the current outbreak scenario, and also it serves as a tertiary referral hospital, being the Karl Hushna, in which most of our moderate to severe cases or severe to critically ill cases are sent. So the distribution and hence the numbers being represented by the slides that you see. In regards to the relationship with the deaths as of April 1st to today, we have that 11 of these individuals have had 9 have had a first dose of their vaccine. We have 18 of them being fully vaccinated, and to which 93 of these individuals of our Belizeans, brothers and sisters, have passed away due to COVID. Hence the realization that we must continue to support the vaccination process as requested and supported by the Ministry of Health. The concern going forward is that many of these, the rates that are being seen in these individuals per 10,000 population is that we maintain for the fully vaccinated a range of 1.2 within our current context. The death rate per 10,000 population is 4.1, hence signaling once again the need to continue the vaccination process across the country, and we need to have the entire population more than vaccinated, surpassing that what we may think is herd immunity, to which we know we had initially started this process by. The associated comorbidities that have been presented in those who are partially vaccinated continue to be the NCDs, which has been not only in this scenario, but the leading causes of death in the entire country of Belize historically. And hence most of our persons who are affected by NCDs, primarily diabetes, chronic renal failure, high blood pressure, asthma, obesity, cancer, HIV/AIDS are some of the most significant diseases that are contributing to the high mortality rate that we are seeing in our population. The concern is why are we seeing our vaccinated population being affected by and passing away by COVID? COVID by itself is a phenomenon. It doesn't spare any person. It produces a severe storm of cytokines. That means it dysregulates your hormonal process. And most of these individuals who have already a compromised immune system, it actually triplicates and produces a debacle of hormones and other mechanisms within our country that cannot be within the body that cannot be regulated by these individuals because of the severity of the disease. The same scenario goes in regards to individuals who are being fully vaccinated, where diabetes by itself, which is is considered a disease that suppresses the autoimmune system or the response. Chronic renal failure being the second cause, high blood pressure, obesity, asthma, and 20% of information not available, whether because we don't have a health-seeking behavior and also the information not being recorded in our health system. It must also be known that, for example, Belize has a profile, and it has a profile of which more than only about 25% of our known diabetics are actually controlled, meaning that we have persons out there who are not controlled metabolically and are not taking their medications. And also with the advent of COVID, there has been socioeconomic challenges to most of our households and families, and also on a personal basis. High blood pressure by itself can be triggered by the pandemic. We've been more than 18 months into this scenario. The access to healthcare, drinking medications, being able to purchase these medications is also a concern. And only about 11% of the entire persons of the entire hypertensive population in Belize are under control. This is something that is of concern for us going forward, not only due to COVID, but because of the risk it poses for further deaths if these individuals are not controlled. In regards to the distribution of the different age groups being affected, we are seeing that out of the 122 cumulative deaths that have been seen as of April 1st to October 12th, many of these individuals are of 65 plus, for which 52 of these persons have been seen. Of concern for us is the 40 to 44 age group, to which many of our Belizeans brothers and sisters are either obese, have uncontrolled diabetes, have been diagnosed as having high blood pressure, which are not controlled. Our population is at risk because of HIV/AIDS, tuberculosis, and other diseases of concern. We're also cognizant that cancer is very rampant in our population, and that this is a specific age group that is of concern to the Ministry of Health across the board. In regards to the districts who are most affected, we're seeing that the Belize district, as I mentioned previously, there's a total of 59 females who are affected in compared to male who are 63. So there's not much of a significant difference in regards to the sexes at this point in time. What we do note that the Belize district, as we previously said, the Cayo and the Orange Walk districts have been the districts most affected by COVID deaths during the last 18 plus months. As you may note, the pandemic, the highest area or the epicenter for a few months ago last year were the northern districts of Orange Walk, in which most of these persons had presented with the normal variant, and now we have the Delta variant in our country. There was a certain certainty that these persons were not controlled, and as such, NCDs continue to be a disease of concern where most of the population do not control their disease. So in essence, that's a brief description of what we have up to today. We expect that there will be continue to present a much more digestive and scenario in regards to the COVID mortality and the different rates that are affected in the next couple of days.
Thank you so much for that, Dr. Mori. Very detailed explanation. I would like to again remind the audience that they are able to ask questions, and of course these questions would be done through the Facebook Live comment section. So go ahead, place your questions, and we will be opening up the question and answer segment in just a minute so that all of your questions can be answered by our panel, of course. So now we would like to go into the presentation of the data and the status of the COVID-19 vaccination campaign countrywide, and doing that will be Ms. Damaris Cruz. Dr. Cruz.
Thank you. A pleasant good evening to all our viewers. I'd like to start by mentioning that to date, there are 6.54 billion doses of vaccine administered worldwide. 2.5% of these vaccines have been administered in low-income countries, in which Belize is included. To date, there have been 153,982 persons fully vaccinated in Belize. The target population for our country is 71%, and up to date, up to October 11th, we have 35.8% of that population that has already been vaccinated. In terms of the population that have the age range between 12 and 17, the target for that population is 58,292. Of that population, 16,846 have received second doses, and that accounts for 25.98% of that population. The following graph is a breakdown of first and second dosage administered by population groups from March 1st to October 11th this year. So this graph is a reflection of all the groups. As we can see, the persons that are 60 plus have a high vaccination rate. We're seeing that 71.8% of this population has already received their second doses, which marks the highest group within this population graph. We are also noting that the healthcare workers are also getting their second doses. Right now, currently, we are at 47.7%, and about 99.8% of the healthcare workers haven't received their first doses. So the graph shows that there is a favorable response by the groups. There is still much work to be done, a lot more individuals to be vaccinated, but the response is favorable thus far. In the following graph, we have a comparison of the districts. We're seeing COVID-19 vaccines, second doses by the districts. As you can see, it's laid out from the district that has the highest vaccination to the least. Arinjoc has 44.8% of its population already having received a second dose of the vaccine, followed very closely by Corozal, which has 40.8% of its population vaccinated with a second dose already, and then Belize with 38.6%, and Cayo with 32%, Stan Creek with 36.6%, and Toledo District with 17.2% of its population having already received a second dose of the COVID-19 vaccine.
Thank you so much for that, Dr. Chris. Very informative again, and that was basically an update when it comes to the vaccination status and the vaccination campaign that has been going around countrywide. So, of course, we would like to remind you again to please ask your questions. We want to make sure that all your questions are answered, so the more time we have for questions, the better. And we will be starting off, of course, with our first question. And that question basically states, what's the side effects of the vaccines?
Okay, the side effects of the vaccine, the most common side effects include soreness and inflammation to the site of the injection, to the site of the vaccine. And most people, if they experience symptoms, they experience fever. Sometimes, some of them can experience headaches. Some of them experience chills, body aches, muscle aches. But most of them are mild. They don't last more than 3 to 5 days, the most. We encourage people that if they do experience these side effects, they keep well hydrated. They are able to take Tylenol or ibuprofen every 8 hours to help with those symptoms, and basically rest as much as possible. These symptoms can be treated and they don't last very long.
Thank you so much for that, Dr. Chris. So those are basically the symptoms when it comes to the vaccines, the side effects of the vaccines. So the other question is from Prana Global, and it says here, can vaccinated persons give blood?
Yes, in terms of vaccinated people, right now it is currently recommended that they can donate blood. If they don't have any symptoms, they can immediately donate. We don't have a time lapse after the vaccine that they need to wait. As long as the person does not have any symptoms, they are able to donate blood.
Awesome. So basically, once you do not have symptoms, you are able to donate blood. Great. Thank you so much for that clarification again there, Dr. Cruz. So we have another question here saying, why can't someone with a negative COVID test dine in at a restaurant?
A person with a negative COVID test, most of the time we are speaking of negative rapid tests, which is the one that's most available. We must take into account that these rapid tests are not able to detect the virus in its early or in its dormant stage. Once the person is exposed, the virus goes through a phase where it enters the body, and until it replicates to a number and amount that it can be detected by the rapid test, it will not show. So having a negative rapid test is not indicative, or does not represent a person not being able to transmit or not entirely having. So I take this opportunity to call on those patients that do rapid tests and have been exposed or had contact with anybody who was positive to be keen, to be cautious, to take note that a rapid test doesn't necessarily mean that in the days to come you won't develop any symptoms. So you need to be observant. You need to look out for the symptoms. If you have any queries, feel free to call the headlines or approach any of the medical personnel at any of our sites so that we may be able to assist you and direct you in terms of a follow-up testing or in terms of treatment if that occurs.
Perfectly summed up, Dr. Cruz. So, of course, again, I would just like to remind the audience watching on the Facebook Live that we do encourage you to ask your questions. This is the question and answer segment of the episode, of the second episode. And also keep in mind that we will be here Tuesdays and Thursdays, 5 p.m. to 6 p.m. So keep an eye out on the Ministry of Health and Wellness Belize Facebook page to keep up to date with what is happening in regards to these episodes. So we move on now to the other question from Ramir Villanueva. And it says here, can you get your seasonal flu vaccine after being fully vaccinated?
Yes, one can get their seasonal flu vaccine, but we must wait 14 days after being vaccinated to take any other vaccine, not only the flu vaccine, but any other vaccine in the immunization scheme that we have in Belize. There must be 14 days in between any of those vaccines and the COVID-19 vaccine.
Great. So even if you have been vaccinated, of course, you can get your flu vaccination. Perfect. Now, go ahead, of course.
Yeah, just one comment, and this is primarily because of the reason for testing and quarantining or isolation. And by this I mean is that we have consistently individuals who may be presenting with symptoms that are typical of the flu. It doesn't mean that you don't need to continue isolating or quarantining in regards to being a suspect. And this is because we are already in October, and we have another 5 months to go, because usually the flu season starts in October and it ends somewhere in March. And therefore the call for individuals who may be out in the community presenting some type of fever, sneezing, cough, sore throat, you are in the specific time frame of the flu season, but and also will be considered as possible suspect case for COVID.
Thank you so much, Dr. Mori. Now we have another question that we would like to move into, and this is, I would say, a two-part question. So it says here, so we know the problem is there. What will be done to try and curb this pandemic, or what measure would be taken? So what would be done to try and curb this pandemic, or what measure would be taken?
The measures that can be taken has to do a lot with us as a community looking at the preventive measures. And we cannot overemphasize those. And that's the only way we will be able to curb this COVID-19. But in addition to that, we have to take simple measures when we are in our workplace. For example, when we tend to have lunch, we cannot do lunch as normal with the entire group in the lounge. You try to find an area where you can eat alone. These are things that you can do to help to reduce your risk of exposure to COVID-19. And in addition to that, we continue to emphasize the physical distancing, the hand hygiene, and the consistent mask wearing. And also, we as a community need to look at what we are doing as it relates to the social interactions, because we know what drives the transmission is high social interactions. So when we say social interaction, we mean we cannot be gathering with family members who do not live in our households. So we need to reduce those types of social gathering as much as possible. Not even gather outside of work. After work, some persons tend to gather and socialize. Those practices are very dangerous as it relates to COVID-19. So we can curb this virus and we can flatten our curve if we are in this together. So we all must do our part to prevent the COVID-19 and to reduce the transmission.
Perfect. Unity is key. So we are all in this together, and we must all put together our hands and basically follow the COVID-19 protocols that has been set forth by the Ministry of Health and Wellness and also the World Health Organization. So now we would like to move into another question that was asked by Ms. Gentle. It says here, can you clarify the wait time for receiving a response to PCR tests? Sometimes people know too late, and instead of quarantine, they go about their normal business.
In regards to the PCR, we understand that we have had issues in regards to the frequency at which the time frame the results are out. Nonetheless, if you consider yourself a person who has been exposed, and by that I mean a close contact to a person who has been positive for COVID, or you come from a household where there are 1 or 2 cases, you are considered positive thereafter. If you are waiting for a PCR, we should, at least within 24 to 48 hours, you should be informed of that result. We are also, as we mentioned, for cognizant that we have concerns that these results may not be on time, but it's only of the person who has been exposed to isolate himself for that duration of the entire duration that is required.
Thank you, Dr. Mori. Again, we would like to remind the audience that this is the question and answer segment. So we have a panel here that will assist you in clarifying any questions that you may have, any misinformation that you may have. So whether it's a statement or a question, kindly go ahead and place it in the Facebook Live comments from the Ministry of Health and Wellness's page so that we can clarify it with our panel here that we have today. So we would like to move on to another one. This is by Ginger, and it says, why don't they close all bars that are operating as restaurants?
The various public health measures that have been established globally and even within our country has shown that there has been consistent areas of deficit where various measures have actually to a certain point failed or have not been effective because of concerns of implementation. And by that I mean we can close all bars, we can close all the hotels, we can close all the casinos, we can close everything, we can continue closing our borders. But as my colleague had recently said, I mean, you have to be cognizant of the times we're living, and it's much more on a personal basis to avoid all these different scenarios and to exercise the public health measures that the Ministry of Health is requesting, which has evidence base, which comes from the WHO and CDC, these organizations that have and continue to advocate for these measures to be strengthened within our households and even as a person or as a community.
Perfect. Thank you so much for that again, Dr. Mori. We have here a question. It says, I got COVID last 3 weeks and I had my second dose dated for first week after I recovered from COVID. Is it okay to get my second dose, or should I wait 3 months to take the second dose after testing positive? I'm asking because a doctor told me to wait 3 months, but a nurse told me I can get the second dose as soon as I get over COVID. Who should I listen to? So would you like me to repeat that once more?
No, that's fine. The general trend of which the Ministry of Health continued to advocate for it's globally. I mean, we don't follow what the Ministry of Health just picks out of the air. The recommendations, the global recommendations, were that you would need to wait between a period of 3 to 6 months to get your second dose. However, or even after being infected and becoming positive, however, there's new literature going out there. There's new concerns in regards to that you're able to get that second dose within the 2 to 6 weeks period of becoming infected. I do believe that, and I'm cognizant that the National Immunization Task Force is reviewing these recommendations currently, and within the next couple of days, the best recommendations as to when you will be able to get that second vaccine or second dose will be sent out by the Ministry of Health and Wellness.
Great, thank you. So we have another question here, but before we get into that, again, I would like to remind the audience that this is the question and answer segment. And of course, this is the Up to the Minute COVID-19 live report. We would like you to ask your questions or ask a question for a friend. Say that a friend said it if you would like. And of course, so that we can ask our panel so that they may go ahead and clarify our concerns, our misinformation, our questions. Whatever it is that you have, whether it's a question or a statement, go ahead and ask our panel. So the other question that we have here is, can an asymptomatic person still infect others? How long do they have to wait before they are all clear of the virus? So that's a two-part question. So firstly, can an asymptomatic person still infect others?
Certainly. If you've been following the period of the incubation period of this specific disease, it gives you a range between 2 to approximately 12 days, 10 to 12 days. However, persons who are asymptomatic are also known as to be have a high viral load, or what they call viral shredders. And with this status, certain agencies, for example, CDC, so have been recommending that up to a 7 to 10 day period, you would, if you don't develop any symptoms, you will be able to be cleared medically. And so if you're diagnosed, for example, today, which is the 12th of October, the best recommendation would be for you to continue in isolation up to at least the 20th to the 21st of October, within that period, and then which you would then be cleared medically, you can be reintegrated yourself into the community.
Great. Now we move into our other question here. It says, it is from June Flores. It says here, can someone with anemia, sickle cell, or low blood count take the vaccine?
Whenever we encounter patients that have a known illness and that have a medical practitioner or a family doctor that has been following them, that knows their illness, we highly encourage these patients to do a consultation with their physicians, with their doctors, prior to taking the vaccine. These physicians know their history, they know whatever medical tests they have done, and they are in a better position at the time to make a decision as to the status of the patient being able to take the vaccine or not. But in general, having an anemia is not a contraindication to taking the vaccine.
Thank you so much for that, Dr. Chris. Now we would like to move into the other question here. It says, it is from Caroline Chan, and it says here, I would like to know why rapid tests and PCR tests are not taken together free. Sometimes the rapid tests say negative a couple days after you start having symptoms. When you pay to take the PCR test, you are positive.
Well, they're not done together because, remember, we have to take into account that both of them take a lot of resources, they take a lot of time. And to maximize the resources that we have, we encourage those that have symptoms or have been exposed to do the rapid test because it has a high rate of detection. The PCR is more costly, it's more timely, and it's reserved for more specific cases. But in terms of the detection of the virus, the rapid test is efficient enough to detect the test. So doing both together would probably be a redundance, and would probably be, in all honesty, probably misusage of resources. No? And there are some cases in which it is necessary to do, but it's not the general consensus of doing both of them together.
If the concept is, and this is where you need to differentiate the person, and hence the questioning from the healthcare worker is essential. And by this, if you're having symptoms, And there is a close contact person, meaning, for example, if you're not wearing your mask in front of a person who's at less than 3 feet away from you, and you're both not using a mask, and that person is symptomatic, the correct conditions and the correct methodology of taking a sample is very essential for that rapid test to be positive. Also, we are cognizant that sometimes person might just be presenting a slight fever, sore throat, and it might be some respiratory process on the ground that is there. But therefore, in many of our cases, we do screen that person with both tests. More significantly, because there is that concept that you become a suspect of COVID once you're presenting symptoms.
And in addition to that as well, remember we have community spread at this time. So since we have high transmission rates, it is recommended for us to use the rapid test. So the turnaround time is quicker, and that is going to help us to reduce the transmission as well, because persons will know their status and will be able to isolate more quickly. And I also would like to clarify, because I think the question said you have to pay for a PCR. Our PCR test, you don't have to pay for a PCR test that is administered by the government. So the PCR test is free, and the rapid test is free at all of our testing sites, and the PCR is done at the Central Medical Lab. So I'd just like to clarify that the test is free.
Thank you so much for that, Nurse Bell. So we would like to again move into our other question. Remember that we do encourage you to ask your questions. If we don't get to your questions in this episode, there will be another episode on Thursday, and that begins at 5 p.m. and it goes up to 6 p.m. So this other question is from George Rodriguez, and it says here, will there be privileges to the vaccinated? When will this come into effect?
I'm certain that the Ministry of Health is currently looking into the various possibilities of extending. I'm going to use the word courtesy of our general population, those who have walked that mile to get vaccinated, for us to have some level of normalcy within our country. I do understand there are various activities going on the ground from the desk of the Minister of Health for these things to be brought forth to within the next few days or weeks for the general community to enjoy.
Yeah, and we are not at that point as yet. As you know, based on the presentation, we only have 35.8% of the population that is fully vaccinated. So we are a little bit away from our target, so we have a lot more to do before we can reach to that level where we can have a little bit more relaxed and allow a little bit more social gathering.
Great. Thank you for that, Dr. Mori and Nurse Bell. So basically, we are not there yet, but we will be there sometime soon. And that takes a collaborative effort between all of us. So get vaccinated so that we can get there more quickly. We have another question here that says, the Janssen vaccine, what is the expiry date on those? I got mine on 14th of September, and it says the expiry date was January 14th, 2022, and wife got hers yesterday. It says May 2023. I am confused.
Okay. So the expiration date that is written on these cards basically reflects the expiration date of the vaccine from the vial which you got it. Remember that each vaccine comes from a vial. These vials are identified with a number, and they're identified with an expiration date, which means that that vial from which you were given that dose would have expired at the date that was written on your card. If you got it before that expiration date, there should be no concerns, because you got the vaccine before it expired. That is just used to identify the batch along with its batch number to identify the exact batch of vaccine that you got.
Thank you so much for that, Dr. Cruz. So basically, it differs between batches. That is what is the main thing with the expiration date. So it differs between batches. Another question that we would like to move into says here, what is the penalty for people walking around in shops, etc., with COVID, knowing they have the virus, just going out anyway?
Yeah, that's one of the biggest concerns that we've had, and I believe if we go back to the SIs that have been continuously revisited by the Office of the Minister of Health, I would really want to take that on a personal basis. That penalty is so high that person learns a lesson. The issue with us is that there's the self-responsibility, the consciousness of that individual has to be questioned. And for certain diseases in other countries, you would be imprisoned for putting the general community or other persons at risk. I don't have that figure on mind right now, what we would do nationally or what is there for us in the SI. But most certainly, the call goes out for any individual who has any respiratory process, who is out there in the community and not using a face mask or not exercising the advised public health measures, to seriously rethink his actions and as he's putting other persons at risk.
And just to add to that, I think we're living in a time where we definitely have to be our neighbor's keeper, and we have to look out for each other. If you know of someone that was exposed or is positive to COVID-19, we need to look out for each other. We need to encourage each other to comply with their isolation and quarantine time so that we curb the spread of this virus.
Thank you so much for that. And if we want to get back to a point whereby we are enjoying certain privileges for those vaccinated and a point of normalcy, basically, we need to put together and do a collaborative effort so as to ensure that we ease the spread of the virus. Now moving on, we have another question here that says, when will non-invasive COVID tests be available? When will non-invasive COVID tests be available?
I believe we're if you're by non-invasive COVID test, you're referring to the other ones that you can buy at certain at Walmart or certain stores in the U.S. I believe that there is we will be having a review, or that has already started in regards to what can be the best scenario for testing and being highly specific and sensitive. Highly sensitive and specific for COVID disease as we go forward.
Great. Thank you so much for that, Dr. Mori. We're down to our last 5 minutes, so we do encourage you to ask your questions. We might not get to your questions in this episode. However, in Thursday's episode, we'll go ahead and we'll revisit the questions we did not answer, and we will go ahead and answer them, or you can always ask again on Thursday, 5 p.m. to 6 p.m. on the Ministry of Health and Wellness Belize page. So our other question here is, how long after you get a positive result should you get swabbed again to see if you are fully recovered?
Because of the current community spread and following key recommendations from WHO, CDC, I believe we had discontinued that process a few months ago. Because what we were seeing is that, for example, in the few months into the pandemic, that we had persons who were testing PCR positive way above or almost to that 90-day period, which is basically 3 months. And that necessarily did not mean that the person was positive. Therefore, it was a learning process for us in which we have been guided by the WHO recommendations and CDC and other public health agencies, including CARPA, that once you have become, for example, if you're asymptomatic and you tested positive, there's no need going forward to repeat a test. If you have been symptomatic and you have been cleared medically, there's no need for you to repeat a second test. These testing might be only specific for certain hospitalized patients who have been either moderate to severe or critically ill, in which there is a recovery period, and I'm following the guidance from CDC whether it's needed or not for us to repeat that specific test. But for the general population, those who have tested positive and have been asymptomatic or have mild symptoms, after you've been cleared medically, there's no need for you to repeat a PCR test or a rapid test, unless within that 90-day period that you continue not following the advised public health measures, you may also be at risk of being reinfected.
Great. Now we are down to our last two questions, and remember, you can still ask your questions. We'll go ahead and save your questions for Thursday's episode of Up to the Minute, a COVID-19 live report. So let's get to the last two questions. This one here says, what is the reason for vaccine application? What is the reason for your vaccine application? When will it be rolled out? And would this be a favored reason for us to finally open up the country so that the less fortunate can at least make a decent living and meet ends?
Can you repeat the question?
Okay, so it says here, what is the reason for your vaccine application? I assume referring to the vaccination app. When will it be rolled out, and would this be a favored reason for us to finally open up the country so that the less fortunate can at least make a decent living and meet ends?
So the vaccine app is currently still in progress. The Ministry of Health will launch will put out an official press whenever we do have the app running, but at this moment that is not the case. And again, we go back to where we want to be in terms of immunity. The target immunity is 71%, and again, we are only at 35.8%, so we still have a long way to go before we can consider relaxing any measures and going back to some form of normalcy.
So again, we are working towards that goal. We are not there yet, but we are steadily working towards it. So the last question for the evening says here, what's the procedure to get an exemption letter in Belmopan? I've tried contacting Ministry of Health, Western Regional, and the COVID cell number and Central Region. All I've been hearing since Thursday is please leave your name and number and we'll contact you. I never got a call back. My employer is not accepting the clearance letter from Western Regional, and they are requiring that I test every 2 weeks. Any guidance would help.
Yeah, for this we plead to the employers to consider what has been established by the Ministry of Health and complied with by the Central Region. The clearance letter serves as a guidance for the employer to note that the person is or has gone through the generally 14 days of isolation and is now clinically recovered and is able to go back into their work setting or community without the fear that they can transmit the disease to other persons. So we encourage as employers to be considerate of what has been established by Central Region and Ministry of Health. The clearance letters serve to, in place of repeating, we've already talked about repeating the COVID test after the isolation period, so the clearance letter is in place of that, and we urge employers to please consider that so they don't have to send the employees to take a test again.
Thank you so much for that, Dr. Cruz. We actually have time for one more question, and that question here is, can you explain why people who are fully vaccinated are dying?
I believe what we've tried to establish is that with the figures that we presented, the biggest concern that we have is that the response on most of these diseases that are persons who have been passing away from, even though being vaccinated, they are quite above that 65 plus age group. There are also persons who have significant comorbidities. You're talking about cancer, various type of cancer, and this is the response as to your immune response is quite delayed, quite affected by this virus. The virus by itself in diabetes is a disorder that produces immune deficiency. It also produces damages to your autonomic system, and that means that how your body regulates itself with different issues. The biggest virus produces a disbalance or an uncontrolled storm of what we call of different hormones and how your body needs to fight a specific infection. This is not only for COVID. And hence most of the biggest goal here is that there's a significant amount of immunosuppression, which the person's defense is very, very low. And so we're talking about persons who have kidney failure, who already have organs that are compromised because of, for example, kidney failure damages the lungs, it damages the brain, it damages your entire metabolism, and even your defense, because it also can produce damages to your bone marrow. So when you have a person who has this condition, for example, his immune system is very, very, very low. And with the COVID scenario infection, there's no response as to a defense mechanism to fight this disease. And so with all this different debacle of lack of response, the person who has heart failure, the person who has kidney disease, the person who has diabetes, the person who has significant uncontrolled, and by this I mean uncontrolled high blood pressure, you have persons walking out there who have never taken a pill in his life for high blood pressure, and his blood readings are way out of control. There are also diabetic persons who have their daily blood sugar levels of 300, 400, 500. So these are significant areas of which contribute to the mortality that we're seeing in this particular group.
Thank you so much for that, Dr. Mori. Now we have arrived at the end of our second episode of Up to the Live, a COVID-19 live report. Remember that the Ministry of Health and Wellness is still doing vaccinations across the country, and in order to keep up to date with the available vaccination dates in your area, check the Ministry of Health and Wellness's Facebook and other social media pages for more information on future vaccination sites. Remember that the Ministry of Health does have a new page, and this is what we're streaming from, so feel free to click the title, give it a like, so that you can stay up to date. The Ministry of Health and Wellness advises the general public to keep wearing your mask properly, wash your hands, sanitize your hands, and maintain proper social distancing protocol. This is the moment for us to stop the virus, or at least control it, right? So with that said, thank you so much for tuning in to our second episode. We'll be back here Thursday at 5 p.m. to 6 p.m. again. So thank you so much and have a great day.